morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided all the topics so far discussed in a very systematic order, and you can make use of it. Thank you very much. So we will continue with the development of the fetus. Last class we were discussing about development of the venous system in the developing fetus. In that, two systems already we have seen. The last one is collateral venous system. The collateral venous system draining the blood from the upper and lower part of the embryo, and this is also called as cardinal system. This can be also called as cardinal system. There is right and left cardinal systems are present. So these are again divided into right and left cardinal system. The veins which are draining from the upper part of the body are called as anterior cardinal veins. Again, right and left, just like the arteries. So the cardinal system which drains the blood from the lower part of the body are called as posterior cardinal vein. Now, before both of them draining into the sinus venosus, they come together and form a common cardinal vein on the both sides before draining to the sinus venosus. Now, in the cardinal system, two things are very important. There will be development of left to right connection. There will be one connection developing, which is called as left to right connection. Left side will disintegrate or degenerate, and another is whole posterior cardinal system will degenerate and new venous system will develop. These are the two important things which are taking place in the collateral venous system, which we'll see in detail. What actually happens is the anterior cardinal venous system, which is there is a communication will develop. There is a communication development from the left side to the right cardinal vein. Left side to the right cardinal vein, which is actually called as left subclavian vein. Okay, this connection is called as left subclavian vein. Then the blood flow in the left side stops and it undergoes degeneration. Okay. Now, the right anterior cardinal vein becomes wide and becomes superior vena cava. Right cardinal vein becomes wide and it becomes superior vena cava. So superior vena cava is derived from the right anterior cardinal vein and also the part of the right common cardinal vein. Right common cardinal vein. So now we shall see some of the clinical significance of this particular collateral or cardinal venous system. Sometimes there will be only one left superior vena cava. Only left superior vena cava. Sometimes there will be only left superior vena cava. Then the left persists and right one undergo degeneration. Usually it should be opposite. Then the communication will be from right to left, draining to the right atrium. Okay. So another possibility is a double superior vena cava. Sometimes both will persist, right and left both will persist, and both will not disintegrate or degenerate. Then there will be no connection from the left subclavian. There will be no connection of left subclavian vein at all. This is one thing. Now, posterior cardinal system development. These three new systems will develop, which takes the role of posterior cardinal system. They are supracardinal, subcardinal, and sacrocardinal. What do you mean by supracardinal venous system? Developing in the chest area. Supracardinal venous system that develops in the chest area deep enough and it starts draining the intercostal veins. Right side is connected with the superior vena cava, but both sides there are intercostal veins draining into it. Now an anastomosis will develop from the left side to right side. That is, right is draining into the superior vena cava. The maximum veins of the left side are degenerated and only the 4th, 5th and 6th or 7th intercostal veins will drain to the right side through a connection, and this connection is called as left hemiazygous vein. Okay, this connection is called as left hemiazygous vein. The right cardinal vein is called as azygous vein. So hemiazygous vein will join with the azygous vein, which ultimately drain into superior vena cava. Okay, so this is the changes which are taking place in the supracardinal system. Now, what do you mean by subcardinal system? It takes the blood from the renal system, suprarenal system, and from the gonads. The renal, suprarenal, and gonadal veins from the left side drain to the renal vein, which joins to the right side renal vein. And left becomes degenerated, and the right becomes larger. Okay, so this is called as the renal part of the inferior vena cava. This is also called as the renal part of the inferior vena cava. Another system is sacrocardinal system. Originally, sacrocardinal venous system develops to receive the blood from the lower limbs. The left-sided veins will shunt with the right side through a common iliac vein, through the common iliac vein. Now, the hepatic part of the inferior vena cava, part of the subcardinal system, that is renal, and also sacrocardinal part, common iliac vein, they joins together to form the complete inferior vena cava. This is how the inferior vena cava is formed. Like this, blood from the lower part is shunted to the right side from the left side. So they are left subclavian vein, left semi-azygous vein, and left renal vein, and left common iliac vein. So this is actually the combination. Okay, this is actually the combination which forms the inferior vena cava. So this is all about the development of the vascular system in the fetus. We have seen the arterial development, and also we have seen the venous development. Thank you very much. From the next class onwards, we will start with the neurological development in the growing fetus. Thank you.